Welcome to VNN. Mississauga Mayor, Her Worship Bonnie Crombie, is without doubt one of the most popular and dynamic city mayors in Canada for the intensity of her involvement in various activities. On April 30, she will be joining local researchers and residents in the Novo Nordisk 5-kilometer Hazel Walk and Run as part of the Mississauga Marathon, which in turn is part of the program to fight type 2 diabetes and promote healthy living. Welcome to VNN, Your Worship.
Thank you so much for having me today. Wonderful to be here.
Why is this event so important to you and the city of Mississauga?
Well, this is a very important event, and I'm delighted to support the doctors and the researchers who are running to raise awareness for diabetes and the 5-kilometer Hazel Run at the City of Mississauga on April 30th. Individuals have an opportunity to register up until the 25th, so I hope you all do. And this year's run is taking place in the downtown around City Hall. It's the Mississauga Half Marathon, formerly the full marathon, but I think they've realized it's just better to do the half. And it's really emerged as one of the most premier racing events in Canada. We're going to see over 6,000 people competing in the different races, from the half marathon, which is 21 kilometers, the 10K and the Tim Hortons trot for those under 10, and of course, the Hazel McCallion 5K. And so I look forward to, I haven't quite figured out my plans. Sometimes I run, sometimes they need me at the starting line and the finish line. But it'll be early morning, 7:40 on April the 30th, which is next Sunday, being sponsored by Novo Nordisk, an incredible healthcare company right here. Its Canadian headquarters is right here. And we have a fantastic team running. Alexandra Gillespie, who's the principal at the University of Toronto's Mississauga campus, the vice president. Dr. Lorraine Lipscomb, the director of Novo Nordisk Network for Healthy Populations at UTM. Dr. Ian Zenlia, the clinical scientist lead at Family and Child Initiatives at the Institute for Better Health at Trillium Health Partners, our hospital partners. Dr. Beju Shah from Novo Nordisk, he's the research chair in equitable care of diabetes. And Dr. Laura Rosella, who is a renowned epidemiologist at the Dalai Lama School for Public Health at the University of Toronto. So we really need to support this dream team because, as you know, we have a higher prevalence in Peel region than across about 60% higher. Let me get this number, 40% higher in Peel region than anywhere else in Ontario. And we know that 1 in 6 adults, 45 to 64 in Peel region, are living with this very preventable disease. So research has shown us that 2 out of 3 people who have diabetes live in a city. And that's why we have so much more we can do with our environmental design of cities, get people out of cars, get them moving. And that's why I encourage everyone to go out, be healthy, walk, run, exercise. I'm sure you exercise. What do you do to keep fit?
I do. I have my treadmill at home, so, and I go out to walk. Just walk. Yeah. I mean, the healthcare cost of diabetes in the Peel region is estimated to be about 700 million in 2024. I mean, tell us about this city's changing diabetes program, which Mississauga joined in, I think, in November last year.
Yes, so Mississauga signed the Urban Diabetes Declaration and joined City's Changing Diabetes program in November of 2021 to connect to an international network of municipalities building and sharing strategies to prevent and manage type 2 diabetes. The city can also access all the CCD resources, such as the case studies from other cities. By joining CCD, that is the cities changing diabetes, and signing the Urban Diabetes Declaration, our council confirmed our commitment to diabetes prevention and to the development of a maiden Mississauga type 2 diabetes prevention strategy. And I'm very proud to say that we are the only active Canadian city that's part of the program. So we now make up a larger network of health experts, policymakers, community leaders who are deeply devoted to understanding the challenge of urban diabetes and working on innovative solutions. So Mississauga, we're working with the community, with our Indigenous partners, with experts, with stakeholders to develop a diabetes strategy to help prevent the rising cases. The strategy is going to lower the number of diabetes cases in the city through a focus on building healthy, complete communities, places where people can walk, compact, walkable cities, a 15-minute city, pedestrian friendly, livable, walkable, transit supportive. Get out of your car, get out of your house, take public transit or walk, or any sort of form of active transportation, your bike, your skateboard, doesn't matter, just get outside. And so this strategy will also contain a mix of supports of daily living that will enable physical activity through active transportation.
What about this research hub that was planned, isn't it? Is it up and running now at the university? A part of the...
Yes, we have received a very large donation from, let me just find my note here on it for you, a very large donation from Novo Nordisk to enable this hub, and this is where much of the research is based. And so we're very, very fortunate to be home to see the hub here that is that forms a great forms the center nexus for the developing the diabetes strategy. Yes.
I was reading that, I mean, so the city is developing a strategy built on a health equity framework. I didn't quite understand that. What is this health equity framework?
Well, it's to ensure, so we're encouraging healthy living, asking people to be more physically fit and more active, take other forms of transportation beside their car, cycle, take public transportation. And on the diversity and equity piece, we understand there are various groups who are affected differently, particularly by diabetes as well. We know that more than half the adults in Peel region identify as Asian, South Asian, Arab, Black, Hispanic, and Indigenous, and there is a greater prevalence of type 2 diabetes among these different demographic and cultural groups. So it's very important that we develop equity strategies that assist people in these cultural groups to work on their physical activity so that we can lower the rates of diabetes in Mississauga and in Peel region. We also know that residents are a little bit overweight in Peel region.
Yes.
And, obesity is the single biggest risk of developing type 2 diabetes. And we know that people who live in cities tend to be more overweight, less fit, and more prone to type 2 diabetes than people who live outside cities in rural areas or suburban areas. So we're encouraging everyone to do what they can to get out and take physical transportation. And we're going to try to build cities that force people to get out and walk. We call it the 15-minute city. So people can leave their car at home and they can access shopping and services like their doctors and dentists and their grocery stores, all within walking distance. So a more livable, walkable city. Those are some of the solutions that we're coming to. These are those environmental factors that we need to build into our city as we're building new communities and new developments.
Also, I mean, you may have to ban traffic from, say, some inner city areas, so that there'll be a place for pedestrians to enjoy and walk. Is there a
Yes,
proposal?
of course. We have lots of parks and natural trails in Mississauga. I live very close to the waterfront trail, and I often enjoy walking the trail and see many, many people. We have more parks, I think, per capita than many other cities, and we encourage people to take the Cullum Trail in the downtown, or visit any of the parks like Aquitaine Park or any of the waterfront parks that exist right here in beautiful Mississauga. There are so many parks in every community. Get out and walk and explore our city.
Is there any support from the provincial and federal governments for your diabetes strategy?
So, the focus of the investment from the federal and the provincial government has been currently on mental health and addictions. So this has been, not that there isn't support. Our hospital, Trillium Health Partners, has different wards dedicated to preventing diabetes. So they are funded, of course, by the provincial government, but the bulk of the funding recently has been to assist mental health and addictions.
Have you got a new pair of running shoes? Have you had time?
Well, as you know, I believe in physical fitness. I just came back from the gym myself this morning. I go as often as I can. So I'm very hopeful I'll be out this year as well, but sometimes I'm needed at the starting line, at the finish line, but I'll be there, whether running or cheering them on in person.
What was your run time last year? I mean, is it
So
going?
I in my age group, okay, I did very well. I placed third. I placed 2 seconds from second. However, I think I could have done better. We ran as a team, and one of our team members got a cramp, and so we ended up as a team walking together. But if I had continued running, I think I could have been top in my age group.
I mean, I think the MP Sonia Sidhu has that some diabetes discussions going on in Parliament. It's very helpful.
Yes, because she was a public health nurse that, excuse me, that focused on diabetes. And as a member of the South Asian community, Sonia Sidhu is well versed on these issues and well equipped to help develop strategies to address fighting type 2 diabetes in Peel region. So I commend her, I applaud her. I want to work with Sonia. She's a great member of Parliament, and she's very knowledgeable on these issues. And she is the lead for the federal government on type 2 diabetes prevention.
Thank you, Your Worship. Thanks for coming on our show. We wish you a happy run, and I hope thousands join in for the various Mississauga marathons.
Yes, I think we'll see thousands, 6,000 at least.
Thank you again.
Thank you very much for having me today.
I will meet at the gala.